Hello, everyone. I'm Keith Ware, and we are the folks that manufacture the Rooke Products, and thank you for joining us on the seminar and basically a modified in-service on how Rooke Products can be a help in preventing hospital-acquired pressure injuries for your patients that are in the ECMO vasopressed condition. Also, we'll take a look at fall protection for your fresh BKAs. And then we'll look at upper extremity hand ischemia and what we have to be a help for that patient population. So as I was reviewing and preparing for this educational seminar, wound and ostomy management in 2016 reported that in the ICU, between 10 and 41% of pressure injuries occur in the ICU, and 14% of those are at the heel. Also in critical care, July of 2019, for VA ECMO, the ischemic limb complication rate can range from 8.6 to 12%. And then in the Journal of Vascular Surgery, April of 2017, for those ECMO patients that did not have a distal perfusion cannula, a third had acute limb ischemia, which can result in necrotic toes, fasciotomies, and they even reported a 0.9% incidence of amputation. So the question becomes, gosh, with this really fragile patient population, what do we have that can be a help for you as the clinician to protect those lower extremities? And that would be the Rook Boot. As you look at it, which has been established for 33 years, you look at it, it's a naturally warm and insulated boot, so you prevent the heat loss. And consequently, what that does is that gives you a vasodilatory cascade to enhance regional skin perfusion. How do we know that? So there was a study done by Mayo Clinic, published in Angiology, May of 1987. Granted, it's it's older, but it's absolutely relevant, because what they established is that ischemic limbs that got a Rook boot had a boost of 5.3 millimeters of mercury in TCPO2s. So let's put that in context. If you were doing TCOMs, you'd want to have as a healing rate between 30 millimeters of mercury and 40 millimeters of mercury, and that's kind of a zone in which to achieve healing. So a 5.3 millimeter boost in regional perfusion and skin perfusion can take a patient that's on ECMO or vasopressors that's teetering on the edge of breaking down and put them into a safer zone for skin perfusion. The other component, and I'll take that off, is NPIAP has always said you've got to have offloading and redistribution of pressure. So with your Rook boots, we have added a Comfort Plus pillow top layer, and I hope you can see that has a gentle slope and a deeper heel cup. So with that, we did pressure mapping on the three body types, endomorph, mesomorph, and ectomorph, and we had 100% offloading of those patient populations. So if you want to see those pressure mapping studies, please stop by the Rook booth, hop on the chat line and let us know that you have an interest for that. Also, you'll notice that there are foot drop wings, and the physical therapy community has always said to us, look, if you're going to have a long-term bed-bound patient, anything beyond 3 days is when you run the risk of foot drop with those patients. So with our packaging, right out of that packaging, you will be able to place your patient in a relaxed neutral position to minimize the chance of foot drop. Also, there's an anti-rotation wedge. Just tack that on for external or internal rotation. And where that becomes exceptionally important is for your ECMO patients and the placement of those cannulas. You don't want to have a patient that starts to frog out a leg, and that can adjust the flow and direction of those cannulas. So what type of outcomes have we had with Rook boots? And I'll need to read this for you so that I have it accurately. We did a really nice white paper with Riddle Memorial looking at their patient population in the ICU. There were 50 patients with 100 limbs, and the inclusion criteria were Bradens of 14 or less and albumins of 3 or less. Other comorbidities were PAD, they were on pressors, a current arterial injury anywhere on that lower extremity, or a pressure ulcer anywhere else on their body. So when you take that inclusion criteria, these were not cream puff patients. And from that, we had a 0 incidence of toe or heel injuries. But what else was fascinating about this is, so that was for 50 patients. 30 of those patients had 39 lower extremity pressure injuries. And while wearing the Rook boots for that 12-day course that we were studying them, 2/3, 66% of those stage 1s healed in 4 days or less, and the rest resolved by the 12th day. And then 40% of the stage 2 pressure injuries healed at 9 days or less, and the remaining showed marked improvement. And those that had a stage 3 or a stage 4 pressure injury, all of them reduced their size by 75%. So really, that's a testament to the excellent nursing care at Riddle Memorial, but the combination of boosts and perfusion that you get with a Rook boot, as well as the offloading of the heel. I'd also like to add that as we were developing that Comfort Plus pillow top layer, we were working with Abbott Northwestern here in Minneapolis, where this session is coming to you live. And we had a series of 145 limbs in their CVICU. And so they get a combination of ECMO, complex cardiac, and complex vascular cases. We had one breakdown, stage 1, at the Achilles in that 145 series, which gave us less than 0.7% of a breakdown rate, which is well below NDN QI standards. And that's a gorgeous benchmark in which to strive for. So if you think about your Rook boots and your ECMO vasopressed population with the range of boosts and perfusion by keeping them warm, offloading of their heels and redistributing the pressure along the calf and further up the leg, preventing foot drop, and that anti-rotation wedge to keep those cannulas flowing in the direction that you want, there's really quite a viable alternative compared to other boots for what you can have in that really compromised population. So the next category would be the Rook BKA residual limb protector. So as we were developing the BK protector, we would talk with vascular nurses and surgeons, and they would say to us, you know, it's not a question of if our patient's going to fall, it's a question of when. And that was really borne out in a Journal of Physical Medicine and Rehab, February of 2017. They documented an incidence of 20% falls in the acute care setting, and also 40 to 60% fall rate in the community care setting. So absolutely at risk. And I hope that you can see this. At the distal end cap of the Rook BK stump protector, we've got a nicely padded end cap, and we're up to 29 reported falls, and those patients did not dehiss, didn't convert to an AK, didn't have to evacuate a hematoma. So it was basically a non-event when they fell. And that's a huge win for that patient. But remember, you own that patient as part of your 30-day DRG window, and that is not a ding against your readmission rate. So that's an important point to take home. Also, there's a rigid splint in the back combined with our signature soft synthetic fleece so that you can have gentle skin contact as well as regional warmth and boost in perfusion. And to document that boost in perfusion, in wounds, we had a really nice write-up, August of 2018. At Madigan Army Hospital, they were using ICGA to measure what's the impact of Rooke products on regional perfusion. And for any of you that don't or aren't familiar with ICGA, that's the use of indocin green. It's a non-nephrotoxic, water-soluble dye that when you shine a certain wavelength of light on it, it fluoresces. So it's an excellent way in which to see a region of interest, what kind of inflow and outflow you have of perfusion. And in one of the patients, fresh BKA, dusky limb, not looking really very good. They were concerned about the healing of that incision line. You might get hiss. So we took a baseline reading and you barely saw that limb light up. Put the Rook BK protector on for an hour, started to show a little bit more. After wearing our device for 2 weeks, it was gorgeous. You could see a beautiful outline of that residual limb as it just fluoresced and lit up, demonstrating that boost in regional perfusion. And happy to say, nicely protected in the event that he fell. That patient did not fall. So the next item is the Rook Mitt. And probably the simplest way to detail is with a case presentation that was done at Sanford Health, in which they presented a patient that was on dialysis and she coded. So they then put her on therapeutic hypothermia, but she had 2 comorbidities that were really so unfriendly to her, Raynaud's and scleroderma. So you can just imagine what the cooling off of that patient would do to exacerbate those 2 conditions. So they put that patient Rook mitts on her hands and Rook boots on her feet. After running the course of that therapeutic hypothermia, she didn't have any breakdown at all on her hands or toes, anywhere else on her body. So that was a tremendous win. And I'd also like to point out, many times your patients are going to have a radial art line, the pulse oximetry, IVs. So you can open up your Rook mitt, place your hand inside, or the patient's hand. Go ahead and close it up with that Velcro and that D-ring. And just gently close it down so that you can maintain that warmth in that hand. So there's also a Rook mitt. Think about that as well as for your therapeutic hypothermia patients. So as I come to the conclusion, I'd like to invite you to think about any quality improvement studies that you may have in mind. Let's see if Rook products can move the needle and improve on driving down those hospital-acquired pressure injuries. And we know that you've got plenty of boot choices, and all the other boots that you have to choose from, they'll do a great job of offloading your heels, but it's really only the Rook boot that's going to give you that combination of the natural warmth, vasodilatory cascade, offload the heel, prevention of foot drop, and that really nice wedge of keeping any of your ECMO patients that are cannulated in the proper position. Also, no presentation would be complete without some comment about the surge in COVID that we're having. And it's being reported for the severe COVID cases, those patients have a thrombotic cascade. And in the Annals of Vascular Surgery, August of 2020, there's a really fascinating paper there that talks about the acute arterial thromboembolism in patients with COVID in the New York City area. I never knew this, but Northwell Health System, which is one of the largest in the New York system, we're caring for 12,630 patients, of which 49 of those had arterial thrombotic events. And I have heard from one nurse, wound care nurse earlier in the year, that said we had a situation with COVID toes, put that patient in Rook boots, and we were able to see that resolve. I'm throwing this out there because I genuinely am not sure how we can be a help, but if you are encountering your severe COVID patients and you've got a thrombotic cascade going on, by keeping those lower extremities as well as hands warm, vasodilated, enhancing the flow, might we be able to reduce that thromboembolic complication that can occur? I don't know. But please, by all means, contact us if you need samples. If you don't stock Rook boots, we're happy to make them available. So my last point, we have the Rook mirrors, so you can do skin assessments on heels or any other location on the body, and you don't have to crane your neck or contort yourself to take a look. Please stop by the booth, register for your free mirror, and we look forward to hearing from you. Thank you very much. And at 1 o'clock, if you just came into the tail end, we'll be doing another seminar at that time, 1 o'clock Eastern Standard Time. Thank you so much for your time. Look forward to hearing from you. Bye-bye.